So, for my presentation, I have chosen Hong Kong and my diversity in healthcare systems of the world by Renee Booth. So, my healthcare system was beverage model. Hong Kong currently survives off of this, and the healthcare is provided by the government through tax payments. This is a form of socialized medicine, a healthcare system owned and operated by the government. In current time, the beverage model is used and applied in Cuba, Denmark, Finland, Great Britain, Hong Kong, Italy, Norway, Spain, and Sweden. There are some more, but those are just the ones that I listed. With the exception of Cuba, they all have decided to remove the profit motive from healthcare. In a simpler explanation, essentially, the government acts as the single player, removing all competition in the market to keep costs low and standardize benefits. As the single player, the National Health Service controls what in-network providers can do and what they can charge. Concerns/problems. There are overcrowded and overstretched sectors. The occupancy in hospital wards in 16 public hospitals reached between 110 and 130% in 2016. The average is about 76% for public hospital occupancy. Private healthcare in Hong Kong is the second most expensive in the world next to the US. A visit to a general practitioner can roughly range from 250 to 1,000 HKD. The cost of childbirth delivery can vary between 100,000 and 450,000 HKD in case of complications. So, to make this easier for everybody to understand, because we live off of US dollars, I converted this to US dollars, and then I found out what it would cost in the US, roughly. And that is 12,875 to 57,937 US dollars. That's what it is converted. And the average cost for childbirth in the US is $5,000 to $11,000. So there's clearly a huge difference. Now, cancer treatments can exceed from 1 to 1.5 million HKD, as seen in a number of recent cases. This is not all cancer treatments, this is just the ones that have exceeded this much. More concerns and problems. Hong Kong has an aging population with high demand and low supply. That means people are asking for too much, and the people that are giving it to them do not have enough to give to everybody. According to the Chinese University of Hong Kong, only 30% of the population will be over 65 in 2033. This will cause a higher demand for medical needs without the hospitals being able to support all the people. Well, I researched it to see what it would be in the US, and in 2033, the US is estimated to have 20% of people be 65 and older. Now, Hong Kong also has a problem with chronic staff shortages. A huge problem. The city has 1.9 doctors per 1,000 residents, but the development body advises 3.4. It needs nearly 11,000 more doctors to bring its public health services up to international standards. On your bottom right, you will see, and your bottom left, you will see two pictures of a few hospitals in Hong Kong. The one on the bottom left will actually be in the video. Again, you'll see it again at the very end of the slide presentation. So now we have Hong Kong versus Cuba. I've listed everything side by side, and I'm going to go by Hong Kong first. Life expectancy, well, it's 84.89 years. Infant mortality rate, 1.2 deaths per 1,000 live babies. There's about 14,290 doctors. That is not exact. Doctors make 50,000 to 83,000 monthly. Converted, that is 6,473 to $10,686 in the US monthly. Hong Kong runs off a non-profit government healthcare system, quote unquote. Now to Cuba. Cuba, the life expectancy is 78.89 years. The infant mortality rate is 4.2 per 1,000 live babies. That is a few more than Hong Kong. I could not find the number of the amount of doctors, but the percentage is increasing. Doctors make about $50 monthly, and the reason for that is 75 to 80% of the income goes straight to the government. So this is what we were talking about before. Cuba is one of the only places that uses the beverage model and isn't a quote-unquote non-profit off of the people's medical care. Cultural differences. People often turn to Chinese herbal medicine, acupuncture, and moxibustion, in which users place cones of burning leaves on the skin. It can be used to cure, I'm going to attempt this word, rheumatism? I think that was totally butchered. And other ailments, and other alternative treatments for illnesses and chronic problems that are not cured by modern medicine. So, a lot of because of the lack and the history behind China and Hong Kong, they have found many of their own kind of ways to cure themselves with herbs and acupuncture and anything that's not modern medicine. Some people have strong dietary beliefs that they may not be willing to change. A lot of people in China /Hong Kong believe what you put in your body reflects how you feel. And again, dietary therapy is a form of self-care, they believe, and is an inseparable part of a total healthcare system in the community. How can beliefs be respected? Well, if a healthcare professional is ever doubting what to say, they should always just ask, as long as it's in a respectful way. In their initial assessments, ask if the person they are treating has any religious beliefs, practices. You need to know about it. By staying aware with the cultures that are happening around you, and not only keeping up to date in the medical fields. So you need to be aware of what's happening in the cultures around you and what people you might see often come in. Being observant and recognizing your worldview may be different than the people you come into contact with. Listen to the patient and make sure while they are sharing their preferences and beliefs, you make an effort to show them that you are listening. So here I have a video for us. And it's kind of the same one as up there. I'm going to skip this ad.
Medical services in Hong Kong are ranked among the best in the world because of availability, affordability, and quality. The city's urban population of 7.4 million enjoys universal health care. That access to care is part of the reason why Hong Kong people have one of the highest life expectancies in the world, 82.2 years for men and 87.6 years for women. The local system is two-track. On one side, there is the affordable public sector. The government-funded hospital authority annually spends 68.8 billion Hong Kong dollars on its hospitals and medical institutions. That's nearly 8.8 billion US dollars. On the other side, Hong Kong also has an extensive private sector. While a public hospital only charges 120 Hong Kong dollars or 15 US dollars per night, a private hospital can charge between 500 and 45,000 Hong Kong dollars per bed. That's a range of between about 60 to nearly 6,000 US dollars. If you can't afford that, you always have the low-cost public system, but you might experience long waiting times before you can be treated. During the peak flu season in January 2019, non-urgent cases at accident and emergency departments in Hong Kong public hospitals had to wait about 8 hours. And when these patients finally see a doctor, consultations sometimes only last for a few minutes because of the lengthy queue outside. The most recent statistics show that the accident and emergency services at the city's 18 public hospitals handled nearly 2.2 million patients in the 2017-18 fiscal year. Patients can often wait for years to get treatment in cases that are not life-threatening. A person with cataracts can expect to wait more than 2 years for surgery at a hospital in Hong Kong's New Territories West area. To see an orthopedic specialist on the west side of Hong Kong Island, the waiting time for the first appointment could be up to 3 years. At the same time, the public system has a serious shortage of practitioners. Administrators estimate they need about 300 more doctors and 400 more nurses on staff. In January 2019, doctors and nurses from public hospitals held rallies to complain about their heavy workload, long work hours, and poor overtime pay. The 2019-20 government budget promised 720 million Hong Kong dollars, that's nearly 92 million US dollars, for staff retention measures. To relieve the staffing shortage, the Medical Council also approved a plan to make it easier for overseas trained doctors to work in the city. Officials have also pursued closer integration of the private and public sectors as a way to relieve some of the stress on Hong Kong's medical infrastructure. The success of Hong Kong's medical service adds to the pressure on it. The city's expanding and aging population are the primary users of the public sector and put the most strain on their resources. Another major challenge for the public healthcare system is its relative lack of comfort and privacy. Limited space often makes public hospital wards overcrowded. Hospital wards sometimes have more beds than they are designed for, and some patients even end up in corridors. So while you're guaranteed affordable healthcare in Hong Kong, it is far from a luxurious experience. By contrast, private hospitals strictly monitor the capacity of wards. Some institutions even offer rooms with only 1 or 2 beds. The private sector handles only 10% of the patients in the city, but employs more than half of Hong Kong's 14,000 registered doctors. This exclusivity and individual care contributes to the fact that private healthcare in Hong Kong is one of the most expensive in the world. It's expensive and the pricing is not standardized among private hospitals. Different institutions will have different prices for the same procedure. The government has ordered at least 2 of the city's 13 private hospitals, Gleneagles Hospital and the Medical Center of the Chinese University of Hong Kong, set to open in 2020 to enhance transparency by pricing some of their services in packages to avoid unexpected bills. With prices so high and often confusing, many people seek private medical insurance. But as in many markets around the world, health insurance in Hong Kong is neither cheap nor easy to understand. So if you need to see a doctor in Hong Kong, what do you do? Going public or private may depend on whether you have a simple runny nose or something more serious. And of course, how much money or insurance you have to pay for it all. But the good news is, you have options either way.
And that was my video. So as you can see, just because they have options does not mean it is easiest. There is a long waiting list for simple things, so I can understand why they have home remedies and herbs and other ways that they decide that have worked for them for decades and years and years and years, and that they still use those to this day. here are my citations. And that is the end of my slides. Thank you.